Hi, I'm Carla Koretsky, Dean of the College of Arts and Sciences at Western Michigan University, and it is my pleasure to introduce this research webinar series focused on COVID-19 pandemic research at WMU. This series was launched in collaboration with WMUX and the Office of Research and Innovation, and will highlight just a few of the many research projects that Western Michigan University staff, students, and faculty have been pursuing to better understand the impacts of the COVID-19 pandemic on our global society. Many of these projects have been funded by WMU's Meter Presidential Endowment, which provides financial support to research projects that advance excellence in learning and discovery at WMU. Some of the research that will be the focus of this webinar series includes studies of the factors that have driven state-level shelter-in-place orders, the impacts of isolation on mental health and how to mitigate them, the responses of religious organizations to the pandemic, and how the pandemic might impact and shape the future of higher education. The mission of the College of Arts and Sciences at Western Michigan University is to ignite and sustain a passion for learning and discovery in the humanities, social sciences, and sciences, to help students, staff, and faculty succeed in life and contribute to the betterment of our communities from local to global. This series and the many other projects at WMU that are helping us to better understand and respond to the current global pandemic are clearly aligned with this mission. Through our scholarship and our outreach to share our discoveries, we seek to improve lives. I hope that you enjoy the series.
For many of us, it's hard to remember what we were doing in March as the university and state made decisions to address the unknowns of COVID-19 by limiting in-person activities. However, within 2 weeks, WMU committed to utilizing our intellectual resources to help address the many issues of COVID-19. President Montgomery funded grants from the Meter Endowment to address any issue related to COVID-19. While we often think of solving COVID-19 problems with vaccines and drugs, and those are important goals, WMU brought to bear resources to address many of the societal and operational problems that COVID-19 presents to the United States and the world. While much more work is required to understand, address, and remedy the myriad of issues related to COVID-19, and unfortunately we could not fund all the worthy studies, it was impressive the breadth of expertise at WMU and the College of Arts and Sciences that are being applied to this problem. I'm very proud of the work done in record time by faculty and students who, in the middle of a crisis and incredible demands on their time to move courses and work remote, invested in helping with these challenges. WMU is proud of its tradition of research, innovation, and creative scholarship that address real-world problems and help develop real-world insights. Those solutions are exemplified by our speaker, Dr. Matthew Mingus. Dr. Mingus, Professor of Public Administration, and his co-PI, Dr. Kevin Corder, Professor of Political Science, both of the College of Arts and Sciences, were awarded a COVID-19 grant through the Meter Endowment for the study of potential factors motivating U.S. governors to issue COVID-19 shelter-in-place orders. Working with graduate student Daria Blanova, they assessed numerous factors in order to explain when governors decided to issue shelter-in-place orders at the onset of COVID-19. It is critically important that facts and not assumptions are used to assess motivations and outcomes. Furthermore, such information is critical for informing future decisions in the face of public health emergencies. Dr. Mingus and his team put politics aside to assess items from administrative capacity to the urban-rural divide to explain when orders were issued. I'm very pleased that Katie John, our Associate Vice President for Government Affairs and our connection to state government in Lansing, is here today to moderate this presentation. The results highlight the key role of state-level politics, and in this webinar, Dr. Mingus will share the team's findings recently published in the journal Policy Design and Practice on American federalism and the COVID-19 response.
Before there were mask mandates, deep nasal swab testing, and 6-foot marks on the floor in so many public places, numerous governments around the world and within the United States focused on movement controls to minimize the spread of the virus that causes COVID-19. By early March 2020, much was known about COVID-19. However, much was yet to be discovered. I've been acutely aware of COVID-19 longer than most Americans, partly because my wife and myself were married in Wuhan, China. In fact, her parents there were locked down for 78 days. They weren't allowed to leave their apartment compound. Even groceries needed to be delivered. In addition, in China, mask wearing was almost immediately mandated indoors and outdoors throughout the whole country. So this personal background drives my interest in today's topic, but so does my career focus on federalism and the decentralization of governments. Decentralization becomes relevant to movement controls in the United States context, specifically because the national government chose not to enact movement controls, except for slowly reducing the flow of international travel into the United States, which was important. Professor Kevin Corder, Daria Blanova, and myself focused on the actions of state governments throughout the United States to control movement of individuals for all non-essential purposes. These executive orders from governors took many names, such as stay home, stay safe, and we settled on shelter-in-place orders, or SIPOs for short, as an umbrella for all of these orders from across the country. Nearly all of you felt the consequences of these orders on a daily basis as schools, restaurants, and daycares closed, gyms closed, tens of millions of people struggled to learn to work from home. Even more people became quickly unemployed. We asked what drove the timing of these SIPOs across our vast nation. Why did the Midwest states and some other states issue SIPOs relatively quickly, while 8 states never issued a shelter-in-place order at all? As a professor of public management, it was my profound hope that states with measurably greater risks for COVID-19 had enacted SIPOs more quickly than states with lower levels of risk. And every day clearly matters with the spread of a pandemic. So as this slide shows, we examined factors that were known at the time to have been associated with COVID-19 risk and mortality, including rates of chronic diseases, the degree of urbanization, hospital beds per capita, whether or not there was an international airport in the state, and more. These factors were selected with the expectation that state executives would seek to manage risk to their residents, and so states at more risk would act more quickly. On the other hand, as a professor of political science, my co-author, Dr. Corder, suspected that political control would be the driving factor. So in terms of political control, we looked at the political party of governors, the composition of the state legislature, the percent of voters in the state that cast ballots for President Trump in 2016, and so forth. These were all measures of partisan control. So let me explain our approach. For starters, we considered a number of ways to decide how quickly a state acted. In the context of COVID-19, it wouldn't make sense to start counting for every state on the same day because some states were impacted more quickly by this virus. Our modeling considered multiple measures, including when the first case was detected in the state, including when the first COVID-19 related death was recorded in the state, and some others. But these seemed too based on isolated incidents to drive state-level decision-making on such an important level. So after exploring multiple options, we started counting from the day that the COVID-19 caseload in each state reached 1 case per 100,000 residents, as a way to normalize the spread across all the states. Days to action started the day a state reached that threshold and ended when a state SIPO took effect. And next, we measured the actual spread of COVID-19 by starting on January 5th, which is the day the World Health Organization let everyone in the world know that China was experiencing cases of pneumonia of unknown etiology, i.e. unknown origins, in Wuhan, and ending on the day that that state reached the 1 per 100,000 caseload. So what did we find? Well, we'll really look at 3 different things here, but the first finding is that all states surpassed this caseload threshold within 79 days of that World Health Organization announcement. This slide is a standard box plot, which indicates the median as the solid horizontal line in the center of each box, the 25th and 75th percentiles as the lower and upper sides of each box, and the range of reported durations as the ends of each vertical line. Also, several outliers are indicated by the asterisks. This figure shows the median days to reach the caseload for each state, with the states separated by political party of the governor. The standard deviation here is fairly similar for red states and blue states. The difference between Republican governors and states with Democratic governors is just 1 day. And so the initial spread of the pandemic was fairly uniform across the 50 states. And the virus truly didn't care much about political party. Well, we wouldn't expect a virus to care much about political party, would we? However, states with a Republican governor and a Republican-controlled state legislature were slower to experience this case burden, and the extent of that difference may be important. Controlling for all the other factors we looked at, our research suggests the states with shared or complete Democratic control were about 4 days earlier than Republican-controlled states to reach the threshold. By comparison, the rural-urban difference is much smaller. The estimates indicate that there was only 1 day separating the most urban state at 94% urban from the most rural state at 38% urban. So political party may have some bearing here. But what of the timing between this initial COVID spread and the issuance of statewide shelter-in-place orders? This was the main reason for our research project, and here we see a very different story. I should note here that many states issued a series of SIPOs. So they increasingly tightened restrictions, and then in May they started slowly loosening restrictions. So the pace varied by state, and for this purpose, the effective date of the first SIPO is the one that we used in our research. This next slide also uses box plots, mainly because they provide a lot of data in an easily digestible format. How to read this slide? The range of days between reaching the 1 per 100,000 caseload and executive action in the state, which included inaction by 8 governors, is quite large in this box plot. 8 states, all with Republican governors and Republican-controlled state senates, never enacted a SIPO by May 30th, 2020. We used this as the endpoint because this is when many states were already starting to open up and relaxing their SIPOs. No one was still tightening movement controls by May 30th. In contrast, there's a very tight range for actions by the states with a Democratic governor, and all those states enacted statewide movement controls within 17 days of reaching the 1 in 100,000 threshold for COVID-19. In summary, the median Republican state waited 16 days after the 1 per 100,000 threshold was breached, while the Democratic state acted in 9 days, a week more swiftly. I'll explain later on why that mattered. A week might not sound like a long time. As it turns out, a week was a very long time with this pandemic. Now, did you notice that I stopped talking about possible risk management factors a while ago? That's because the host of other factors we looked at served as extremely poor predictors of when a state would issue a SIPO, whereas the political party in control of the state government, including divided government, served as a very strong predictor. How strong? To help you quickly visualize this, we split the states into 4 groups to illustrate the political party in power. So one group was a Democratic governor and a Democratic-controlled state senate. The second one, a Republican governor with a Republican-controlled state senate. The third group would be a Republican governor with a Democratic-controlled senate, and the fourth group would be a Democratic-controlled governor with a Republican-controlled senate. And so the third and fourth groups are the instances of divided government. So this slide illustrates the use of tools of survival data analysis, treating each instance as a different, distinct event. States that do not experience the event, i.e. issuing a statewide SIPO, remain at risk the next day. In other words, for each of the 4 political configurations on this slide, there is a line showing the percentage that adopted a SIPO on each given day after reaching the 1 per 100,000 case threshold. And as you move to the right through the days, the line heads higher because it represents the cumulative adoption of SIPOs. 3 of these 4 political configurations, as you'll see, reach 100% adoption of a statewide shelter-in-place order in 2.5 weeks. So in 2.5 weeks, all states with Democratic control or with any form of shared control adopted a SIPO. In contrast, the red line shows the states with Republican control of the executive and of the Senate, and they were significantly slower to act. In addition, 8 of those 22 states where the red line goes flat for nearly 2 months, 37% of those states never issued a SIPO by the time the other states were starting to open their economies back up and allow a much freer range of movement. So similarly, we employed this idea of an accelerated failure time model to estimate the impact of selected state features on the implementation of a SIPO. This model really shows that with or without including those 8 states that didn't act, that the non-political factors were only minimally predictive of when a state would act. Compared to the impact of the political variables, the impact of the other state features is quite small. These are the ones that we tried to use to think of the risks that a state might have for COVID-19. The total population, for instance, is on the order of days, not weeks, in magnitude of the impact. Specifically, with all else being equal, a governor of a state with 10 million residents would have acted about 4 days faster than a governor with 1 million residents. So that's pretty brief compared to 2.5 weeks, or going 2 months without enacting a SIPO at all. So finally, the impact. I keep talking about issuing statewide shelter-in-place orders, but did the timing really matter? In brief, yes, it absolutely mattered. I can explain this in 2 ways. One, a Columbia University research team estimated that 50% of all COVID-19 deaths occurring before May the 3rd would have been prevented if social distancing and lockdowns had started just 1 week earlier. 1 week is the difference our research found between the political party in control of the state. So that's pretty extensive. But the Columbia study is really based on retrospective modeling, whereas the actual data of caseloads at the end of July is much more based on facts or clearly measurable numbers. The Johns Hopkins data, which is kind of the gold standard when it comes to measuring how many cases there are in the US and around the world, show that 8 months after that World Health Organization announcement, the 8 states that did not issue a SIPO were showing a per capita case burden of 1,100 people per 100,000 people, while the other 42 states had a median per capita case burden of 900 per 100,000 people. A lot of factors might account for why the US has experienced such a high caseload compared to other countries. But in this case, political party strongly identifies those states that never issued a shelter-in-place order, and their median caseloads, based on that Johns Hopkins data, were 22% higher 4 months after the other states issued shelter-in-place orders. And that's the bottom line.
Hi, I'm Katie John, Associate Vice President for Government Relations here at WMU, and I'm joined with Dr. Matt Mingus. I apologize, I think we experienced some audio difficulties, but we should be back now. So thank you so much for joining us for this live chat. Dr. Mingus has graciously agreed to answer audience questions related to the topic. So I'm gonna go ahead, if you could submit those through the live chat, then I'll read them and try to group them and organize them in a meaningful way, and hopefully we can get to all of your questions. And so I'll start off by first asking Dr. Mingus, were you surprised at the inconsistent response to a public health crisis, Or does our federalist system of government indeed predict that we'd have such a fractured response?
I think that's a great question here because my general research interest has to do with federalism and decentralization. And so you definitely notice with virtually any policy in the United States that across the country, different states are doing different things. So there are kind of two types of policies, those where the national government exerts a lot of control and those where they choose not to. And when it came to COVID-19, the federal government decided not to exert movement controls except with regard to international travel. And so that did leave it to 50 states to come up with different solutions on their own.
Great. Well, and it seems like here in the state of Michigan, we certainly have an interesting case study. We do indeed have a Democratic governor who issued numerous executive orders and stay in place, shelter in place rather, and got significant pushback from a Republican legislature and ultimately a Republican majority on the Supreme Court. I'm assuming that these developments did not surprise you in your research, and in fact, were in line with what you discovered. What impacts do you think that these decisions could have, the partisan politics being involved in a response?
Well, part of the paper that we wrote definitely looks at the increase in political polarization. And it's not just something that's happened in the last 3 or 4 years, it's something that's happened in the last 20 or 30 years in the United States. And so seeing that was a factor that really mattered here wasn't, I guess, a huge surprise. Seeing that it affects the decisions being made by a supposedly independent judiciary is a little more of a concern, I would say. And Michigan is not the only state that has these executive orders being challenged within their court systems for sure. But what you did see just about a week ago with the Michigan Supreme Court was that they unanimously agreed that the executive orders were not supported under one Michigan law, and that by a 5-4 decision of 5 Republican justices to 4 Democratic justices, they decided that the earlier law did not apply. And so that did fall clearly along party lines. And the ruling decided essentially that the orders were acceptable for the first 30 days, but at the point where the legislature chose not to support the continuation of a state of emergency, the governor had no right to continue making that decision. I think we'll see a few more decisions like that in other states, because the research definitely shows the political polarization on this topic. It doesn't surprise me, I guess, as a researcher, but also as an American, to see that shutting down the economy is incredibly painful. It hurts a lot of people. It throws industries out of business, airlines going crazy, millions and millions of people becoming unemployed. So it's not surprising to me that movement controls versus I need to be able to feed my family is a huge issue. What does surprise me is that mask wearing has somehow become political. So that somewhere along this continuum of me having total freedoms and rights and my rights being restricted to help deal with this problem in society, we need to find a better balance as a society, and that's going to take a long time.
Okay, we have some questions coming in the live chat. So the first one being, are there any non-political factors that in retrospect you wish you would have looked at, like, for instance, PPE availability?
The challenge is data, and we could only work with factors where we could find consistently collected data across all 50 states. And so we were able to find the hospital beds per 1,000 residents across all of the states that was collected in the same manner in all 50 states. PPE availability would be interesting because even the states at the time, I don't think, could have told you what their own PPE availability was. And so it would be a great factor to include in terms of risk assessment, because part of risk assessment is what's our preparedness to respond to the crisis. And if we knew we had a lot of ventilators stocked up and good PPE for our healthcare workers and for our policemen and firefighters and so forth, then the risk level looking higher wouldn't be as serious because our ability to take it on might be higher. And so we do not have that set of factors included. So very good question.
It was a very good question. And it appears that a number of states throughout our nation, the cases of COVID-19 are again on the rise again. I think on the news this morning, they quoted 38 out of the 50 states have seen a significant increase in cases. So what would your hope be for the main takeaway or lesson learned from this important project, and what could lawmakers and policymakers really utilize if they indeed do have to deal with another wave?
Jacob, is it possible you can throw that other slide up at this point? Okay. We've definitely noticed an increase across the states, and it's, you know, as a resident, as a citizen, it's pretty disappointing and scary. The data, even in the presentation, I mentioned at the end, the caseload at the end of July being in the 8 states that didn't have a shelter-in-place order, 1,100 cases per 100,000 people. Today, that's 2,900 cases per 100,000 people as the median in those 8 states. At that point in time, it was 900 per 100,000 people as the median in the other 42 states. Today, that's up to 2,100 per 100,000 people. So we've seen a massive increase. But what we've also seen in terms of the research is that the spread between the states that did issue SIPOs and didn't issue them has grown and grown and grown. So late July, as I mentioned at the end of the presentation, it's 22%. Yesterday, it was almost 40%. So the gap between states that acted with strong executive orders and states that didn't is continuing to widen. And you know, that's kind of a bottom line takeaway, I guess. It's pretty scary. But as the slide you should see on the screen, the graph from the New York Times, this is in their electronic version today, shows the US compared to Europe and Australia and Canada. And we were coming down pretty sharply. So we hit our peak in early July, and you saw us drop in terms of new cases per day, drop in half by early September. So we were experiencing a lot of comfort by seeing a problem that was declining. And so what you're citing in terms of the statistic is we got too comfortable and it started going back up. And at this point, we're tied with Europe for being the highest level there. And Australia still practically at zero, New Zealand still practically at zero, Malaysia practically at zero, Canada kind of between Australia and where we're at and where Europe's at. The big differences there weren't about internal movement controls. The countries that are down really close to zero stopped international travel very early, and they still aren't allowing international travel. Some of these countries, like New Zealand, didn't even allow their own citizens to return to New Zealand. So by stopped international travel, I mean they shut the border down. And so they never had a large internal problem because they acted quickly, sealed it off. That's pretty hard to do with a place as big as the United States. So we didn't take that strong of an action.
Well, it's certainly, I think, a fascinating time to be a researcher and to be able to look at these issues closer and pull out some of the factors on what's motivating our public policy makers and decision makers. So we really appreciate. I think it's a fascinating topic, and it really piqued my interest. And I'm so happy that you looked at it further. It doesn't look like we have any more questions, but do you have any closing remarks you would like to give, or a summary, or I would like just personally to remind people, I think that research like this does indeed showcase to us how important it is to be civically involved and to exercise our rights, and to, no matter what side of the aisle you fall on, but make sure that you participate. I think it's 18 days till the election, so I want to make sure that people get out and vote, because we can see through projects like this that indeed who we elect and who is representing us does matter. So I would encourage people to get out and vote. But I'll let Dr. Mingus have the last word and summarize his thoughts. Oh, wait, I'm sorry. I apologize. I think we do have a couple more questions come in. So let me pose those first. Do we know how much testing these other countries are doing? You cited Malaysia, China, Australia.
Yeah, the health systems, when it comes to any type of transmissible disease, tuberculosis, the flu, a COVID type disease, SARS, MERS, and so forth, health systems in most of the developing world are very advanced, so that hospitals report these to their state or county authorities, who then report them to some sort of national system. So in the US, if we were doing no testing, if we didn't know that COVID-19 existed, we would very quickly start to see this pattern, and things would get reported, and then the CDC would be like, what's up? Because they would see this data flowing into the national systems. So the reason for using that New York Times graph is that those are countries that we know have very advanced systems for tracking and reporting diseases. Malaysia is as well, China is, Japan is. There are lots of other countries that have pretty effective systems. So when you look at New Zealand, for example, if they had 5 cases show up in 1 week right now, they would freak out. They have the testing capability, but first and foremost, they're looking for doctors to say this person has symptoms that might indicate it. So a lot of countries are doing, per capita wise, a lot more testing than we are, but this has changed a lot. So when this kind of really was live in March and April, we did not have the testing capacity. We ramped it up pretty quickly. If I was showing symptoms right now, I wouldn't be in this room. I wouldn't expose myself to other people. But Western Michigan University would get me tested in less than a day if I was showing symptoms. That capability didn't exist in April and March and June. So our country's changed, but so have other countries, I guess, in terms of testing.
Great, thank you. Do you see any way to leverage your findings to an analysis of vaccine acceptance, either flu or COVID-19 when available?
Oh, wow. Gee,
You can tell that comes from a researcher.
Who did this come from? The U.S. has a pretty healthy and in a sense of large and potentially growing anti-vaccine movement. So I don't mean healthy in the sense of it's a good thing. It's not an issue that we've done research on. I think it is an issue that will come into play when some vaccines are approved. I think it will be very difficult in the current environment to require people to get a COVID-19 vaccine. They're being developed quickly. The long-term tests that are usually done on vaccines over years won't have had the time to play out and so forth. My child's own pediatrician said what's going to happen here is people most at risk are going to get it first. They're going to need it first. It's going to be a long time before we're giving this to a 3-year-old or an 8-year-old, because we really want to know we're not creating long-term health risks to that person. But if you're already 70 and you're at risk, the threshold for safety might be lower in your mindset and in your doctor's mindset. So, that's reporting from one pediatrician. So what does that mean? I think what it means is, in the same way that federalism has led to different results in terms of governors choosing to issue or not issue shelter in place or movement control orders, every state has different laws about the exceptions to vaccines. And lots of organizations and hospitals and school systems have different rules about the vaccines that are required to participate in their activities or work in that workplace and so forth. And so we're going to see a very fractured system. And some states have kind of a wide open policy of acceptance of just sign here saying you don't believe in this and you don't have to have it. And other states have much more isolated reasons, and you would have to prove that you personally, medically, could be harmed by getting it. So we're going to see quite a convoluted response when it comes to vaccines in terms of what you can do. But I think the anti-vaccine movement it's not going away. And so you're going to have a significant percentage of the population, say you have a vaccine early 2021, a couple of years later, you're going to have a large portion of the population that's still not vaccinated because they don't want to be, as opposed to because they can't be.
It is a whole nother area, I think, of study that could certainly take up significant amount of your time.
Absolutely,
Yeah.
And I'm not a public health expert per se, and so it's definitely an area that I'm sure a lot of them are already working on.
Right. Well, it looks like if you have any last minute questions, we encourage you to submit those on the chat function. Otherwise, I think that if you do have any last words or summary, then we'd be happy to hear from you.
Okay. Well, I would say that I stress a bit about the difference between 8 states versus 42 states. There could be a lot of other things that are different in those 8 states. It's not just the political party of the governor and the political party of the Senate, but the political culture of those places is different. And so that's something that we're going to continue exploring of what are the commonalities in those 8 states that, so even if they had shelter in place orders, other things might be at play there. And so in any one research study, you can't look at everything. And we think we looked at a good deal of the potential risk factors as risks were known at the time in March when decisions were being made about these, in April when decisions were being made about these. We knew older people with diabetes and cardiovascular disease and so forth were more at risk of getting this and were more likely to suffer severe consequences of having COVID. So we didn't try to read into what did we know in July? What did we know now? We just looked at factors that governors could reasonably have been expected to know in early March when they started making these decisions. And so that's one thing to understanding the complexity of a research project is that's why that list is what that list is. And we know a lot more, I would say, today. The great news is the medical community learns a whole lot faster than we have. And so they're treating this with medicines that have been around for a long time even. They're treating this so much better than they were. And so the risk of severe complications is lower than it was, much lower than it was prior to June for sure. And so those are, I think it's great to see those successes, but we can't let down our own guard because we still know that this spreads in the air. It spreads when I don't have this on and I cough close to you, or when I have it on and I'm real close to you for a long period of time, you're still going to get exposed. So, so certainly the difference here between the United States, all 50 states and so forth, versus some of the complexities in Asia or in China is that people in Asian cultures are very used to wearing masks. Prior to COVID-19, if you had flown a domestic flight in China, you would have seen a quarter to a third of the people wearing masks. If you had been in a subway, you would have seen the same thing in China. So because of their prior experiences with communicable diseases, their willingness to put a mask on right away was like they were in front of the government on this. They were like, I'll do what I can to protect myself and my family and my coworkers. And so that's a difference. That's, again, a political culture difference between the systems. So this isn't about who did it right and who did it wrong, but the numbers show that we didn't manage it well. And that part's pretty clear, I would say. And it's starting to surge again. percentage-wise in Europe, it's surging at a much faster rate, but we were already way above where Europe was. So I think it does show that we did not, in fact, manage the first cycle of this very well. And the question that only time will tell is, are we right now heading into a second cycle? Is winter going to make it worse? And so follow the advice of your doctors and all the public health officials, which is get a flu shot. It reduces your chances of being in a hospital, being exposed to people who might have COVID-19 because you're less likely to get the flu. So, I mean, that's a practical step you can take today. Go out, do what they're telling you to do, and try to protect yourself and your family and those you love.
Well, thank you so much. We can't thank you enough for sharing your work with us and for doing this important work. And so, and thank you to all the viewers for joining us and for submitting your questions. This is the first in a series of webinars that will be put on by the College of Arts and Science. And so I think we're gonna pop up a slide on the upcoming dates. So if you could join us for those, we'd love to have you and be very appreciative. So thank you again, and we'll see you next time.